I don't quite see it as being a paradigm shift, but it's much more than an add-on. So it's probably closer to being a paradigm shift because we're using technology to take a bottom-up approach almost to healthcare nowadays, with people taking in charge of their own data gathering, people bringing information to their doctor from their Fitbits or from their wearable sensors. So people are getting involved and taking part. So in that respect, it's a paradigm shift, but it's happening slowly and naturally as new technologies come on stream, so it's a slower process. And more people are becoming involved in it all the time, so I think it's somewhere between both of them. So if I had to choose one, I'd say paradigm shift, but I'm not quite comfortable saying that because it's not suddenly happening, it's happening over a period of maybe a decade. The healthcare system will be completely unrecognizable in 15 years time, or even 20 years time, because it'll be data driven, not medical professional driven. So data about people for one person will be useful to understand your own body, but spread that out across populations horizontally, and then you would have massive information about everybody in a country and their healthcare, and then you can start learning a lot more from that. So in that respect, it's going to be a massive change. I think the biggest roadblock towards successful implementation of eHealth is probably people and their slow willingness to engage with the process. You get some early adopters who are monitoring their own blood sugar levels, wearing Fitbits, wearing such devices to analyze their life activities, but that really has got to move across the whole population. People have got to be willing to wear devices that gather data, but also really have to be willing to share that data with professionals, and not just share it with their single doctor, but share it across universities and institutions who want to mine that data to extract a better quality healthcare system for everybody. So I think people have a concern about what happens to their data, whereas their data is really, really valuable when it's spread across the entire population. I actually think it's a mixture of the engineers, because engineers have got to be able to develop a privacy-aware, secure data storage infrastructure for people's personal medical data. And right now there's a lot of concerns about hacking of servers and people's passwords being released. That can't happen when it's your health data being hacked in by somebody else. So this is really, really important. The engineers have got to solve the problem of data privacy and data security. People have got to be willing then to share their data and put it online. This is a really, really important thing as well. People are less willing to do that right now because they're afraid. They're afraid of what will happen if my blood sugar levels get hacked. It may not be, there's probably nothing that's going to happen, but the people are afraid of that. So this is the issue. I would be inclined to say that it should and has the potential to move much faster than it is moving. You may find a lot of intransigence by the incumbent medical professionals who don't necessarily want to gather or embrace customers taking control of their own medical data. Yet I really feel that to progress, move forward, we have to have people taking charge of their own data. What I really like in terms of conferences is when they're interdisciplinary. When I get to talk to medical professionals, and I'm a computer scientist, when we get different people coming together, sharing ideas, potentially looking at ways forward. Most of the progress in the research I've come across in my past 10 years as a researcher has been when I work or my colleagues work with people who are from a different discipline and get to apply what we've done to actually help people in the real world. And that's what's really important. That's why this is a really useful conference for me, because I can start to understand real world challenges, but also identify people who we can then start to work with in the future and then roll out what we've built technically into have a real world impact.